Julie Alexander, and I'd like to introduce you to Dr. Lindsey Mashburn. Dr. Mashburn is OBGYN here in Cornelius, North Carolina. She grew up right in the Carolinas, grew up in Charlotte, went to school, medical school at University of South Carolina in Charleston, did her residency at Wake Forest, thank you, and now is practicing here and is now no longer doing OB, but is doing GYN and particularly specializing in healthcare concerns of women at menopausal age and beyond. So she has got some great resources, which we may not have time to tell you all about today, but I recommend that you look up her website and learn more about her practice because she's got some innovative stuff going on. But today we're going to talk a little bit about menopause and what it is anyway. And so, Dr. Mashburn, can you tell us a little bit about what is menopause and what people typically expect?
Sure. So menopause is a natural stage of our life where our ovaries, which are designed to create eggs to get pregnant and reproduce, those eggs have we've used up all of our eggs, and that leads to some hormonal changes. And the hallmark changes are decreased estrogen levels and decreased progesterone levels. And like I said, this is a normal part of aging, but it can lead to some distressing symptoms for about 75% of women who go through menopause.
75%, wow.
So, and the most common symptoms that you hear about would be the hot flashes and the night sweats.
I think we've all heard about those. You hear people talking about how they're having their own personal summer or something like that.
Right.
But what are some of the symptoms maybe that people don't think about having that maybe you see that people are confused about?
Right. So other things, oftentimes we'll see women who come in, sometimes even sent by their husbands, because they're more irritable than they used to be. And so I had one patient that, her husband had always left cabinet doors open, but going through menopause, that just drove her crazy. And so that was the big thing that brought her in. And then some people have new onset anxiety as a result as well. And so, if you've been going through life without really much issue with anxiety, and then all of a sudden you hit, mid-40s, 50, and you're dealing with a lot of anxiety, it could be hormonal. The other thing would be joint pain, changes in sexual desire, and pain with intercourse would be common complaints as well.
Great. Now, you mentioned an age range then. What is the age range where people can go through this phase?
Right. So average age of menopause in the U.S. right now is 51. However, anytime after age 40 is considered normal. And most women will start having what we consider perimenopausal symptoms anywhere between 6, even 10 years prior to actual menopause when you stop having periods. So this whole transition can be a very long period of time.
And what's the latest you've ever seen someone go through?
Yeah, the latest I've ever seen is 61,
oh,
but that would be very unusual. So for most people, it's not going to be 61. I would say most people, it's late 40s to early 50s.
Okay, great, wonderful. And so, as people go through that phase, what are some ways that people can take care of themselves? Just from a wellness standpoint,
right.
Just during and after menopause,
right.
What's important?
So the first thing always with taking care of yourself is healthy diet and exercise. So there studies even suggest that healthy diet and exercise can make the menopausal transition easier. Oh. Even stretching before bed can help with hot flashes and night sweats. So there are lots of kind of self-help things that you can do to help. And as we had talked about before, everybody agrees that everybody needs more fruits and vegetables in the diet, so start there. And then there are prescription type medications that you can take for menopause. There are hormonal and non-hormonal options. There are also things like acupuncture that have been shown to be helpful. Yoga, and some over-the-counter type supplements like black cohosh that have been studied, wild yam extract. So there are some options other than prescriptions, and everybody's kind of different in how they want to approach their health care. So I think it's always important for you to talk to your healthcare provider about what your preferences are so that we can always help you to find what works best for what you want. So.
That's very refreshing. I know it's nice to hear a healthcare provider talk about honoring people's preferences and meeting you where you are. We're all different, and we all have different goals and desires and preferences, so that's wonderful. after menopause, are there any particular concerns people have to be careful about in terms of what might happen that hasn't happened before?
There are. So osteoporosis is probably one of the big ones as far as medical things that we see. So the decreased estrogen levels that occur with menopause start to increase the fragility of the bones. So depending on your family history and other risk factors with your health, we start doing bone mineral density scans to evaluate for risk of osteoporosis. Again, things that you can do on your own to reduce that risk would be getting enough calcium in your diet, getting vitamin D either through the sun or through a supplement, and doing weight-bearing exercises to help reduce the risk of osteoporosis. There was actually a study done that showed that jumping 6 times a day can help reduce the risk of osteoporosis. So again, there's always something that we can just do ourselves that'll help reduce those risks.
Great. Now, you mentioned hot flashes because that's a very common complaint. Did you say 75% of women might have something like that? And you talked about things that could prevent that. Are there some things that we shouldn't do that can aggravate them?
Things that we shouldn't do. Well, so, unhealthy diet, I think, alcohol, drinking wine before you go to bed, even though you think that's going to be a relaxing thing to help you sleep. It's really probably not the best idea for menopause.
Good to know. All right. Well, thank you so much for your time today. Is there anything else you'd like to add before we wrap up?
No, I think that's it.
Okay. Well, thanks so much for joining us today. Thank you, Dr. Lindsey, for being here. And I hope y'all have a great weekend. Bye-bye.